Well, I'm Olivia. I am a nurse by training and a global health advocate. I chose to pursue the Peace Corps because I was working at USAID before this in the Office of HIV/AIDS. I was working on pediatric and adolescent programming and policy development, and I was really loving my job, but I felt like I was talking this talk without really having walked the walk. I didn't quite understand what I was developing policy for. I didn't connect with these groups that I was developing policy and programs for. So I wanted a little bit more in-country experience, and I thought a really good way to leverage my skills and share them with others would be through Peace Corps response. So I found this opportunity here in Malawi to serve as a nurse educator. A couple of the activities I really engage in include teaching as a lecturer. That's one of my primary roles. I teach anatomy, physiology, medical nursing, surgical nursing, and the associated skills with medical and surgical nursing in our skills lab here at the school. When I'm not teaching students, I might be tutoring students individually or holding office hours for my students. So there's quite a lot that I do, but I wouldn't be able to do it without my teammates here at the nursing college who've really shown me the ropes here. So for example, I came in really excited to collaborate with my colleagues in a digital space, whether that's like sharing PowerPoints or, the sort of sharing curriculum that's already been developed. And I found out that it wasn't. So a new goal that I set by the end of my service was, how can we create a digital environment for my colleagues to be sharing curriculum, be sharing these PowerPoints. I think it all comes down to like sense of fulfillment. That is success to me. If I can leave here knowing that not only did I get to engage with my students and have an impact on their education, but I can fulfill a capacity development role, which I feel like I'm doing. I've learned so much from my colleagues on how to improvise in healthcare. When you are faced in a low resource setting and you're choosing between administering in different syringes because you have few, or you have to give a second line antibiotic because the country has been out of stock on the first line of antibiotics for months. You really get to absorb the different approaches that people take to get to the same results, to get to the best patient outcome with limited resources. When students can verbalize to me that they've understood a topic, after a skills lab session, when they come up to me and, "Madam, I get it now," or like, "Look what I've done," that provides internal fulfillment. And for me, the session or the project that I implemented was successful. I think it's a universal question for all volunteers to question why they're here. Like, what am I doing here? Robin came to do the site visit and he asked this. He's like, "What are you most proud of?" And I had mentioned I'm really most proud of my patients and how I'm showing up for my students. And he said, "Olivia, your presence has impact. You can't forget your presence has impact." And for whatever reason, like, that just struck me. And I was like, you're right. Like, I might not leave here in the end of my service with all my boxes checked of what I thought I was going to do. But at the end of the day, like, my presence, my being here, showing people maybe my work ethic, showing people my smile despite things happening back at home that are chaotic and upsetting, or showing up to the workplace, my workouts with enthusiasm and excitement, that in itself has impressions on people. I don't regret any aspect of joining Peace Corps. It was, and it has been, one of the most precious, sacred chapters of my life that I know I'm going to reflect on for the rest of my life and be forever grateful for. In the same light, I think I would continue on Robin's message of your presence has impact. If you're in the right mindset and the right space, you have an opportunity to be a beam of light for others. And I think that speaks volumes.